It is estimated that oral diseases affected nearly 3.5 billion people. Why do people do not take oral health as serious as they should?
So oral hygiene is something that over the years has been bypassed as not important. But this plaque is usually what causes gingivitis.
Mm-hmm.
Plaque, and what can cause it is lack of vitamins too, like vitamin C and B plus. The B vitamins and the C vitamins can help to strengthen the gums, so that circulation is well and nice around your teeth and gums. But
what are your take on kissing? Can kissing be bad for us? Purpose then, but give a pain.
right. So that's it. So it's a non-functional.
My name is Brian, and I have a dream to create a non-profit organization through my podcast to help spread cancer awareness and other illnesses that's affecting the world at large, and to financially support those who are diagnosed with cancer. My mom died of breast cancer last year, and I've set a target to hit my 1,000 subscriber by her death anniversary in March next year. You can help me to achieve that. I've noticed that 73% of you who have revisited this channel have not yet subscribed. Please, your subscription means a lot to the growth of this channel, and my promise to you is that this channel will get better and better and better, and it will help to scale the guests that I have on this podcast. Above me, there's a QR code that will take you straight to my YouTube channel to save you all the hustle. Now, do we have a deal? Thank you. Oral disease, while largely preventable, pose a major health burden for many countries and affect people throughout their lifetime, causing pain, discomfort, disfigurement, and even death. It is estimated that oral diseases affected nearly 3.5 billion people worldwide. Untreated dental tooth decay in permanent teeth is the most common health condition according to the Global Burden of Diseases 2021. Prevention and treatment for oral health condition is expensive and usually not part of the National Universal Health Coverage benefit packages. Most low and middle income countries do not have sufficient service available to prevent and treat oral condition. Oral diseases are caused by a range of modifiable risk factors common to many non-communicable diseases, including sugar consumption, tobacco use, alcohol use, and poor hygiene, and their underlying social and commercial. If you suffer with bad breath or bleeding gum, then this podcast is for you. Please stick around as we cover a lot of oral hygiene issues that's affecting the world today. Welcome to the Ivy Cancer Podcast, where we discuss cancer, health, lifestyle, and healing. And today it is no different. Today we have in our midst a doctor, a dentist that's been practicing medicine for years. And we will be discussing some oral hygiene for this podcast. And before we introduce him to the platform, we just normally have a word of prayer because you know my mom personally, and you know she's a woman of God, and she always like to begin things with prayer. And the fact that this podcast is based on her or experience losing her, you know, it's only fair to, you know, start my podcast, you know, in honoring her and to give God thanks. Normally, I would ask my guests to pray. If not, then I will go ahead and pray.
That's all right, man.
You,
Almighty God, as we do this program, we're just asking you to help us to help others that they may understand and feel a bit more comfortable in discussing and applying things to their oral health and oral hygiene. We hope that this program will bless many lives, and so Lord, we thank you. So As we say this, we say thanks again for your many blessings and mercy all around the world, wherever you may be. We hope that this will be a blessing to you. And we say thanks in Jesus' name.
Amen. Thank you for giving us this opportunity, Mr. Query. It's been a while. I haven't
Yes,
seen
it has,
I haven't seen you for a while.
yes, it has
Uh,
been a while, bro.
yeah. So I really do appreciate you taking the time out to give us some information about our oral health. Um, so basically, I want to ask you a few questions surrounding oral health, and I hope it benefit my listeners
Sure.
and people who are passing by. Um, why do people do not take oral health as serious as they should?
Oral health traditionally is according to culture, according to which part of the world you are. You know, people don't think that the mouth is actually the important part to the rest of the body. Oral hygiene is part and part of all things that happens to your body. It's what you put in your system. It's what goes through all of the other system that goes through the mouth most of the time. And so oral hygiene is something that over the years has been bypassed as not important, but it's actually the um, very life of everything that enters to the body and function of all the systems of the body. Depends on what your oral hygiene is.
Okay.
So because of that, people do not understand that they do not take seriously. Um, in Jamaica, traditionally, you have people who just pull the teeth out and put in a denture, not realizing
Mhm.
that this is unhealthy.
Right.
But it's part of our culture to wear a denture with lots of gold teeth and all of that, right?
Right.
So
Right.
that's it. So you will find people who extract their very good teeth and put
Hmm.
a denture in,
Just to
not realizing
just a style.
just the style, not realizing how much that affects their life
Hmm.
and the function of the rest of the body.
Okay.
And so that's one of the major things, to revitalize the awareness of what oral hygiene really is. And it's just now being catching on in Jamaica.
Okay. Winston
Yeah.
Query. Who is
Yeah.
Winston Query and why do you do what you do?
Winston Curry is a retired trained dental assistant who has been in the practice for almost 40 years. And my thing is that I love to see people uh, uh, regain their self consciousness. Usually, when you have bad teeth, bad breath, but your self confidence is way low,
Right.
right? And I've had the pleasure of going through all of this with people, or lots and lots of people will regain that sort of confidence, regain even better health because of what I do and what transpires through oral hygiene, oral health, and the rest of it. So that is my thing. I want to see people live better lives, um, be more confident with a bit better smile, and that's my real satisfaction.
Okay. You mentioned bad breath earlier.
Yeah.
Why do people get bad breath?
Bad breath could be it can be two main causes: poor oral hygiene and also problems with your stomach. You can have ulcers in the stomach that cause bad breath, and because the acid in the stomach is reflects through the mouth,
Mm-hmm.
you can have that. But most of the time, it's because of poor oral hygiene.
Okay.
So people don't brush properly, they don't floss, and especially one of the most important times before you go to sleep, because then bacteria is all over in the mouth,
Mm-hmm.
and that affects bone and your soft tissue in the mouth,
So
right? And then this ends up to what we call gingivitis.
oh, so I was going to ask you like what is gingivitis because I've always heard about gingivitis from I've been young.
So
Explain to me. Yeah.
gingivitis is actually when plaque or when food is left on the teeth for more than 4 hours.
Mm-hmm.
This accumulate bacteria and bacteria that are so harmful that they start to attack your gums and your bone structure.
Oh, okay.
So within a matter of say 6 to 7 months, you'll have puffy gums, bleeding gums, and that bad smell, bad odor.
So that is what cause give a bad breath.
Yes, that can
Gingivitis.
cause what we call halitosis.
Oh, okay. So
So the more you're not cleaning, the more you're not brushing, the more you're not flossing, the gums get more inflamed because this is actually an infection of the gum.
can that be corrected?
Yes, it can. It can.
Oh,
There's a myth in dentistry that says bleeding gums don't bleed. So once you have a brushing your teeth and you see blood, then that means your gums are not healthy anymore. So we have what we call cleaning for that. We do deep cleaning and scaling.
mm-hmm.
Um, and we take all of that plaque and because over time plaque becomes what we call calculus. And calculus is the thing that stays there on the teeth.
Mm-hmm.
It adapts itself so well that the toothbrush will never ever get that off again. So we have to do that deep scaling we call it prophylaxis to
Mm-hmm.
get rid of all of that stuff from the teeth so that the gum can start to breathe healthy with new blood supply to it and get back on being a healthy gum.
So this can happen without even plaque. What if you have bleeding gum without plaque?
Usually because plaque is present. Plaque is usually what causes gingivitis.
Mm-hmm.
Um, Plaque and what can cause it is lack of vitamins too, like vitamin C and B plus. The B vitamins and the C vitamins can help to strengthen the gums
Mm-hmm.
so that circulation is well and nice around your teeth and gums. But once you have plaque on your teeth,
Mm-hmm.
then this won't help you at all because you have to remove that plaque. And remember, I tell you that if your plaque is allowed to stay on the teeth for more than 4 hours,
Mm-hmm.
then you create a bacteria film which
Mm-hmm.
attack because all of this comes from food, especially sugars,
Mm-hmm.
which form that thick film, and it then produces bacteria that produces what we call acids.
Oh,
And these acids are so strong that it can causes enamel to melt,
really?
actually.
What?
Yes, because this acid enamel is one of the strongest bone in the body,
So
part of the
we are
body.
human dinosaurs then. Dragon.
Well, you could say that because plaque is strong enough. That acid that the bacteria converts
Mm-hmm.
that sugar and all of that stuff on your teeth to acid. And
Okay.
that acid actually bore the enamel of the teeth. That's what causes cavities
Mm.
and actually melt away the bone support. So sometimes when you see some people with some long teeth and and they look like the teeth growing out, usually plaque is the thing that goes underneath that bone structure and actually dissolve it.
Oh.
Yeah. So
Oh.
the plaque, once you can remove that plaque daily
Mm-hmm.
by flossing and brushing properly,
Mm-hmm.
then your teeth won't have to go through that sort of stress
Okay. So
because once
so
you
we
clean that off, then that's it.
so how often we should brush and floss?
My theory is 3 times a day, but you know what? Over the years, we have seen where not only 3 times a day, every time you eat, you should be able to brush.
Really?
Yeah.
Whoa.
But, we have a busy world and all of that. And
Yeah.
the one most important time you should never ever forget to brush is before you go to your bed. Because then your mouth is closed, that plaque gets to multiply. There's no saliva helping you to dissolve that
Mm-hmm.
because your mouth now becomes a greenhouse for bacteria.
Okay. I see.
Yeah.
I see.
So bacteria will multiply even more during sleep.
I see.
Yep.
So, like tooth decay, how serious is it?
Tooth care is very, very serious, especially for people with like heart problems, other functions of the liver and kidney. Because remember, these are very, very, very harmful bacteria that once the tooth is decayed, these bacteria can get into your bloodstream and go straight to any of those organs, especially, sorry, your heart.
Mm-hmm.
Yeah, that we call congenital heart failure because these bacteria will block those valves in your heart. Uh, that's how serious toothaches are. Tooth caries are a
Okay.
decayed toothache.
Okay.
To note, they found out that this fear of talk, that
Repeat,
toothache that killed him,
repeat that.
that fear of talk,
Fear or talk.
that famous pharaoh in Egypt that they found his tomb and all of that. It's just
Oh,
history.
fear. Oh.
Yes, yes, Tuck. His name was Tuck.
Okay.
Actually, it was a toothache that killed him.
Really?
Yes, that's it. When they found out the toothache was infected, the infection reached his heart and he had a heart failure.
Oh my gosh.
Yeah.
I didn't know that.
Yes, yes, yes. So toothache is very, very, very dangerous.
As you
There's
mentioned,
also
carry on.
because of yes, because of it, because of the seriousness of a toothache, that abscess can travel through your bones. And I don't know if you ever see people with a big scar on the cheek.
Yeah,
That
sometimes, yeah.
fistula, that fistula passes through your bone, passes through your jaw, and then it have an outlet, like a pussy outlet.
Yeah.
That is how serious a toothache is.
What one of my manager couple of years ago, but he used to love sweets.
Hmm.
He had one of that big one on
Yeah.
on his cheek.
Yes.
But
Yeah.
he said it was caused by sweets because he used to love sweets.
Yes. The tooth rot
Mm,
gathered all of that bacteria and started eating away the tooth and the bone support and the tissue support and went straight through to the outside. Now that's being lucky because if it goes the other way and goes inside your blood system and inside picked up by your blood supply, and that can go straight to your heart, straight to your kidney, straight to your liver.
uh,
You know.
when you mention about the heart attack, I recently come across a study that our oral health, it traced back to certain sickness,
Yes.
such as diabetes, erectile dysfunction, cancer. Can you shed some light on that for us?
Because of the bacteria that enters the bloodstream,
Mm-hmm.
you know, and these bacteria will alter the circulation system in many, many ways, you know, so that your insulin and your all of that blood supply that supplies all the nutrients to
Mm-hmm.
those parts of the body can get blocked by these bacteria.
Okay.
Yeah.
So oral health can be life-threatening, in other words.
Oral health is life threatening if
Uh,
it's not handled properly. and if it's not evaluated to the sort of person, individual, so if you're diabetic, if you have a heart condition, you know, your oral health is very, very important, because to do a simple cleaning, or what we call a prophylaxis treatment, a patient with a heart problem would have to go on an antibiotic for a couple of days
Mm-hmm.
before you could clean the teeth, because all of this bacteria will end up in the bloodstream and end up in the heart, especially the valves of the heart can get blocked by these bacteria, and that will cause heart failure.
So how does it affect fertility?
Well, I guess I'm not too versed on the fertility part, but I guess it's the same way, You,
Okay.
you the gun enters your bloodstream and cut down on your sperm count.
Okay. So everything
Yeah.
runs through the bloodstream.
Everything goes through the mouth, goes through the bloodstream. So that's why it's very, very important to
I,
have
I
a
was I,
healthy oral hygiene.
I was watching a podcast recently, and the dentist on the podcast was speaking, and she said she had a patient, a young lad, and he had a problem by not wanting to swallow, and
Hmm.
it was an issue for him. And when they take him to the dentist, and she asked him, "Why do you not swallow?" And he said to the dentist, "Because if he swallow, because he had a bug, if he
Hmm.
swallow, it will bring bacteria down in his stomach, and it will cause more problem." I think he was
Hmm.
8 or 10 at the time. And
Hmm.
the dentist was shocked because a young lad at his age have these things in his head. Like
Yeah.
how did he know about these things?
Yeah.
And she couldn't disagree with him because she said
Yes.
yes. So is that a possibility? If you're sick, you swallow your saliva, it can cause further damage.
Well, as I said, everything goes through the stomach, through to the blood system.
Yeah.
And so if your mouth is infected with gingivitis, or a bad toothache, or you're having abscess,
Mm-hmm.
then this will influence what goes through your blood system,
Oh,
you
okay.
know. And maybe the stomach cannot kill all of those germs and bacteria that is going through the
Mm-hmm.
stomach, through to the blood system. So yeah, it's very, very, very possible.
Okay. Um, when I'm brushing my teeth, um, do I when I you're brushing your teeth and you have the toothpaste in your mouth.
Mhm.
Um, do I need to wash that out, or just spit it out and that's it?
You mean the stuff that you brush it?
Yeah, the toothpaste. When I'm brushing my teeth,
Yeah,
normally you just wash out after you finish brushing your teeth. You would
yeah.
normally wash out your mouth.
Hmm.
Some people have a theory that you should not wash out your mouth. You should let it stay, or what? What are your take on that?
Well, I think you should, anything that you brush off your teeth, you don't want to swallow it. So,
Oh,
uh, practically, I'd say wash your mouth really well after you brush.
oh, okay,
Mhm. And that's
okay.
why they invented these fancy mouthwash. Some of them are good, some are just commercial.
Uh,
But you have mouthwash that are really good, that helps your gum and helps to localize plaque in your mouth. You know?
So in your take, what are some of the mouthwash? You may not have to give us any brand, but like
No,
what
no.
what
There
should we
is
look
some
for into a
there's a
mouthwash?
substance that some people manufacturers put in their mouthwash. The name is chlorohexidine. So any mouthwash that has chlorohexidine, that will help to localize plaque and localize the circulation around the teeth.
So
So
that is
chlorohexidine is one ingredient that you should look for in a mouthwash.
that is a good mouthwash with
Yeah.
chlorhexidine.
Any product that has in chlorohexidine, yes. So it's,
Ah,
It's one of the better brands.
okay. I was taught that our microbiome, we have a, a couple thousand microbiome um in our mouth.
Yeah.
How does that help us? Like, how does the microbiome get bad?
Right. So what are microbiomes? Bacteria.
Or
And you
bacteria?
have them in stages. You have bacteria, you have spores, and you have viruses. Now those are just four of the many more strains of bacteria in your mouth,
So
right?
so it can just leave from being a good microbiome to being a bad microbiome.
Um, no. Microbiomes are where those bacteria are. That's where they you can determine if they are good or bad. No, those bacteria in the mouth, especially in your tooth decay, in your gingivitis, those are bad ones,
Okay.
right? But the mouth can relate to them because there's a balance,
Mm-hmm.
right? So if you don't have bad gums, if you don't have bad teeth, then those and you can get rid of the plaque in your mouth, then all of those microbes will survive because they will balance out. Now
Mm.
when the balance is broken by gingivitis, tooth decay, the rest of it, then you don't have a balance in the mouth at all.
Okay.
Yeah.
Okay. Fair enough. Um, what are your take on kissing? Can
Sorry.
kissing, what are your take on kissing? Can kissing be
Well,
bad for us?
I wouldn't want to kiss somebody with gingivitis, would I? Or tooth decay. Yeah. Because then I would be transferring you would be transferring all of the bacteria to me,
Ah,
right? Now that's what I'm saying. That now if my mouth is clean, then the balance would be all right. Yeah.
oh.
But then suppose I have the same problem as you, then
So
you'd
somebody,
escalate
so
that
so so somebody with bad like tooth decay
with bad oral hygiene.
oral
Yes.
hygiene, they can pass on things to us who have a good. Uh,
Yes. Yes. I have no doubt about that. I don't think
so
it's clean.
so people who have this um this thing about them who kissing on first date and people that they don't know. It's
And that's very risky.
risky.
Because you in the mouth you have viruses too,
Yeah.
right? So if you have a flu virus and you kiss somebody with that, you're gonna get infected.
Uh,
Yeah. So it stands to reason that kissing is risky.
like
Unless you know your partner well.
it changed my whole notion about kissing. Like, when I see these researches, I'm like, really have to be careful,
Yeah.
for me personally.
Especially in these times when you have so much viruses going around, and the first place they usually attack is your nasal passage, right down to the back of your throat.
For me personally, I mean, I like kiss anyways. I mean, I like just kiss.
Well, if you're kissing the right person, Brian, you would
Yeah,
have to
yeah. If
worry.
you kiss the right person, that good. But
Yeah.
cause I observe a lot,
Yes.
I observe a lot, So if for instance, say you go and you meet somebody, you look.
Yeah.
My mother always tell me, you want to know how a person hygiene is, Look on them teeth,
Right.
Look on them
And
nails,
then usually, Brian, when you look at somebody, and the first thing that attracts is a smile. So when somebody smiles and there's plaque and there's calculus on the teeth, you know, then there's a odor,
Yeah.
because halitosis is right behind that.
Yeah.
So, so it tells them so much about that person,
Right.
tells so much about that person, whether
Right.
they're taking care of themselves or whether or not they're taking care of their oral hygiene, you know?
Right. Right.
Yeah.
I want you to explain to me what is the logics behind a wisdom tooth? Because for some strange reason, everybody me know them have problem with them wisdom teeth. Like literally, me have a wisdom teeth in my mouth right now. Like ever so often it just get swell up and just But I'm afraid to take it out. To be honest with you, but me know me have to go take it out. I have an appointment now as well. I'm waiting for an appointment now to get it extracted. But I one of the scariest feelings for me because I've seen so much people struggle with taking out their wisdom too. Why is it so difficult?
Your wisdom tooth normally is a non-functional tooth. What we call a third molar is a non-functional tooth. Most times it's not growing properly, and it does what we call you have what we call a impaction. So most time that wisdom tooth will never ever grow out. If it does, then it's so far back that you're not gonna be able to clean it properly.
Yeah,
So we advise that, and most dentists would tell you that, take all four of them out, because um, not only is it non-functional, but it comes like a garbage pan around there. It collects all of the food that you
oh
can
my
get rid of,
gosh.
and then the body will respond by getting it swollen, so that that all empties itself. That's the way, until you get maybe a decay around there or whatever. But that's the way of the body protecting itself from all of that stuff that is around there.
When you
You
say
know,
non-functional, what do you mean?
you don't use it to eat, you don't use it to chew.
Say not a purpose then, but forgive me pain.
Right, right. So that's it. So it's a non-functional tooth.
Because in COVID, um,
Yes.
it have me down so bad.
Right.
Like I had to go to the dentist several times. I had to be going to the dentist
Hmm.
to get things to
Antibiotics.
right
Yeah.
to get it down.
Yeah.
But
Yeah.
I went to the dentist a few like last year, late last year, and well early last year, and I went late, so I went to dentist twice for the same tooth, and they gave me a single toothbrush.
Hmm.
So what I do when I finish eating, I would just put that single toothbrush down because it's like it in our hole.
It's an interproximal brush, so you get to push that right through and clean the
Right.
stuff on
And
there.
brush
Yeah.
it out. And I noticed
Right.
if I start doing that, I don't have that pain.
Right. But then all of that stuff won't be able to accumulate over time and cause that infection of the gums.
Right.
Right.
That, this is serious, man, because as non-functional, it only
Right.
let me give a pain.
In most American children, they don't have, as soon as they come up, the dentist would extract them, so they don't have third molars at all.
So why we don't do that in Jamaica?
One, sometimes they are very expensive to do because they're impacted, as I tell you, they're not coming up straight. Sometimes you have to do surgery
Right. That's what they
to
said.
go around
I
there.
have to do surgery on mine.
Right, right. So it's a surgical procedure, which is very expensive. So,
Oh.
that's one of the main cause.
My father
And
bring
then
me to the dentist.
the
Sure.
general dentists don't usually like to do those sort of extractions. So it's a specialist, we call them an oral surgeon, who really do those sort of
That is what I
extractions.
realized because when I went to the dentist, she do an X-ray and she was like, "Ah, you can live with it." I was like, "Live with it? This is painful, you know."
Mm.
But when I went
Yeah,
back the second time, I realized the dentist who I see the last time, he said to me, "No, I need to get it extracted." But they
yeah.
don't do it. We have to do they have to
Right,
go to a
right,
specialist, right? So
right.
I am
Those
waiting on the
the
specialist
oral
right
surgeon
now.
is the one.
Right.
Yes.
So he said to me it's best to get it out. And
Yes.
I said that's what I want to do, but I'm just scared. But I make
Yeah.
up my mind to get it out because
Mm.
if it stay there, it can cause problem, don't it?
It will cause problems. It will always act up like that.
Yeah,
It will. You get a swell and you feel pain in your ears right down to under your throat. It's very, very uncomfortable.
right. It's crazy, man.
Yeah,
Crazy.
yeah.
But can the food we eat shape our jaw?
Yes. The 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 food. Well, no, because it's more modern food chain that we have. It's very soft and all of that. So our jaw is not working. But people like, back in our days who used to chew coconut, chew sugar cane, chew all of that stuff, you know, does help the promotion and growth of the jaw. But then you have some people who inherit upper jaw from mother and a lower jaw from the father, which is usually little or small. So you have overcrowded, you have spaces, and these are what we call malocclusions. Yeah. And usually because when we're aware of all of that over time, then doesn't matter what we chew or what we eat, you would need what we call orthodontic treatment to correct those processes.
Okay.
Yeah. But
Okay.
people from a rural area, they have a better alignment of the teeth because of the stuff that they eat, more sugarcane, more bones, more harder foods than people in the urban areas who, depend on just, softer foods,
Yeah.
which doesn't take a lot of chewing and all of that, to do. Well, but chewing what we would call mastication of those food would help to maybe create a better jaw or a better biting surface.
Oh, okay.
Yeah.
Okay.
So food
Yeah.
has a lot to do with it. And it starts from infant because usually people who use in studies gone by, people who used to say that a pacifier is bad for the baby, but it
Mhm.
actually helps because it helps to create a wider jaw for the teeth. Yeah,
So can that be bad as well?
the pacifier.
Yeah.
No, well, as I said, it depends on the patient itself because usually when the baby is small, the jaw is soft, so you can,
Because I see
yeah.
where pacifier shape some kids' teeth like a buff teeth as well.
And that
Depending on
can
how.
cause, right, and it can cause from sucking your tongue too,
Yeah.
sucking your tongue, all
Yeah.
of that. So it depends on the malocclusion that the person has.
Okay.
You know?
Okay. What is a root canal?
So a root canal is what we remove the nerve and the blood supply from a tooth that is maybe uh, susceptible to decay, and you want to save that tooth. So the periodont the specialist who does that goes in, take out the nerve, take out the blood supply, and plug it with special material. So the tooth is there, but
Hmm.
it's only dead. It's a dead tooth. It's like a dry tree. You don't want to trap it down,
So
so
there's
you
no
keep it
blood going
together.
to the teeth.
The tooth is non-vital, as we say. It's dead.
Oh. Oh.
Yeah,
So
but
is that can that be good
that,
for us
that
though?
yeah, because the tooth is there. You don't lose the tooth at all.
But if any blood not going towards the tooth, can it cause
That's
like.
why the canals are filled with special medication and special filling material that that enables it to stay in the teeth, stay in your jaw without any infections.
Oh really? So you
Mhm.
mentioned specialists. It's not all dentists can do that.
All dentists can do it, but there are specialists who really do root canals.
Okay.
That is their specialist. Yeah.
So it would be advisable to go to someone who
Who
specialize
know
in.
who specialize in that. Yes.
Okay. So like how often should we visit the dentist? On our average, how often should we visit the dentist?
Usually we'd say every 6 months.
Hmm.
But because of the type of food and the stuff that we eat nowadays, they're saying every 4 months we should really have a teeth check.
Every
At
four
least three
months.
times a year.
Ah,
Yeah.
okay. Um, like in Jamaica, we have a thing they call medicine,
Yes.
where you would put your toothbrush on your face products or whatever in.
Right.
The UK, we don't really have that here in the UK. So
Yeah.
it beats me to ask a question like, how should we store our toothbrush? Because I've seen a video, whereas when you're flushing your toilet, you should keep the lid down because the
Hmm.
bacteria from out that toilet would come up and it would surface
Hmm.
into your bathroom. So you think about
Right.
your toothbrush that's been on the
Right.
sink or on the face basin
Right.
or on the window ledge, or like, in my head that is something bad. So like, how should we really store our toothbrush?
Usually, because now everything comes up, you have a kit, right? So, my personal view on that is that I would keep my toothbrush in a case, make sure it's clean
Mm-hmm.
before some people just brush their teeth, wash off the toothbrush, and put it in the thing, yeah.
Right.
But my advice is to make sure your toothbrush is clean. You put it in the kit that it comes in,
Yeah.
and you keep it in that container that it comes in.
Okay.
Yeah, because uh in Jamaica or anywhere around the world, there are other insects that can invade your bathroom and crawl over your toothbrush too. So you're transferring more bacteria in your mouth.
Yeah, I've always noticed that. And it's like, because like I said, over here they don't have that
Yeah.
thing where you put your stuff in. You just like have a little cup, or
So
that hold
nowadays
on.
you have your personal kit, so I'd advise people to just keep their personal kit to themselves.
While I was preparing for this podcast, I was going to ask the question again because time um ran out on me because I have so much things doing. But while
Hmm.
I was doing my research for this podcast, I came across a study with caveman. Um,
Hmm.
but caveman never used to use toothbrush or anything like that.
Hmm.
But when they die, they still have strong, healthy teeth.
Yes.
What's the difference between the caveman and us today?
Or diet.
Ah,
Cavemen were built with bigger, larger jaws. Maybe they had about six molars. They weren't exposed to sugars. They weren't exposed to all of the chemicals that we are exposed to. So when they eat meat, it's just usually raw or barely cooked, and they had other things that they usually eat. So this revolutionizing, that there wouldn't be much plaque left on the teeth after a meal. And that's my personal view. So they had bigger and stronger teeth than we had
so
because they were made
would you say that the
to
food that
tear
we are
and
eat
crush meat.
would you say that the food that we are eating nowadays is affecting us in many ways then?
In a lot of ways. In a lot of ways, especially oral hygiene. Yeah. We have more sugar in everything that we eat.
And sugar damage our teeth
Um,
as well, right?
Sugar is one of the worst thing for your teeth because sugar contains that sucrose, which produces acid enough to bore a hole in your chest or a hole in the floor. That's how strong that acid is.
So
And most of us do not consider it when we drink a soda, when we drink a fizzy, when we eat ice cream or anything that is sugary. No, that's why we say nowadays the studies show you should brush after you eat.
Just to see
Doesn't
that
matter how
now.
many times you eat, you brush
Just
after
seeing,
you eat.
so
Not
just
three
seeing that.
times a day alone. Yeah.
So a
So that's
baby,
logical.
so her baby, because when I was growing up, my dad bring me to the dentist and I had to remove a few teeth from
Yeah.
because they was growing rotten because I used to eat a lot of sweet and stuff. But I've seen some babies now
Mm.
that have like a covering over the tooth. Like
Yeah.
I can't describe what it is.
Right. What they do is they have a calcium it's a I'm not too pretty now because I'm retired. I don't have
Yeah.
I'm not really in dentistry that much. But they have calcium films that they can or what we call it that they put on a tray, put it in your mouth. The child's put it inside the child's mouth,
Mm-hmm.
and it stays on the teeth, gets hard, and protect the enamel of the milk teeth.
Oh, so could it be milk that damages the child teeth?
Hmm?
Could milk damage the child teeth?
Not milk. Well, milk is very good for a child, but depends on if it's flavored, if it has any sugar in it. Straight
Ah,
milk would be all right,
ah.
but we have so much flavored milks and all of that that could be that. And in some cases, when a child is left with a nipple bottle to suck on it over a period, you have some people who allow the child to sleep, to fall asleep with a bottle of Milo or a bottle of flavored milk, and that acid is in that thing, and it actually causes those tooth decay over time. Milk
Oh.
teeth usually are what we call milk teeth, the deciduous teeth are usually built or to grow to protect themselves
Mm-hmm.
from because they're not going to be exposed to a lot of sugars. So the first 1 year or so a child's life, those milk teeth shouldn't be affected by any kind of caries or oral problems. But
Mm-hmm.
because we usually give the child um, drinks that are filled with sugars, that affect them before they start changing their teeth.
So
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 that film that you see on the child's tooth is or on the teeth itself is a special barrier that they put over the teeth to protect the teeth
okay.
from cavities.
Okay. What you said that call again?
That well, I'm not sure what it is, but I know it contains fluoride and all and calcium and stuff like that.
Okay.
Mhm.
Okay. Um, Mr. Query, we we really appreciate you taking the time out to give us these insightful information about our oral health, and I really do
Yes.
appreciate it. On this podcast, we have an opening and a closing tradition. And our closing tradition is we normally would ask the guests to leave an encouraging word for the next guest coming up, not knowing who that next guest would be. And the guest that leave that encouraging word for you is Aidan Atkins. And he said, true happiness is to enjoy the present without anxious dependence on the future. And that is
Mm.
Aidan encouraging word to you. Thank you again, and you have a wonderful week ahead.
Yes, you too, Brian. It's so what a pleasure seeing you again.
All right. Yeah. How's the family?
Uh, Everybody's all right. Everybody, growing up just like you.
Yeah, yeah, yeah. Say hi to
Yeah,
Miss Query
everybody.
for me, please.
I will do, Brian.
All
Will
right.
do.
Take care, man. All
All
right.
right. Take care
All
of
right. Cool.
yourself too.
All right.
All right. Good, good.
That's the end of another podcast. If you like what I am doing, please consider to give me a like because the like help the algorithm so that YouTube could push out my video. Until next time. Please stay safe, stay blessed, and eat healthy.